Our next talk is by Dr. Famita Karani, and she'll be speaking on the fundamentals of offering dermal fillers in your practice.
Thank you so much, Wendy, and thank you, Jonathan, for enlightening us. I'm from Vancouver, so it's nice to have a lot of trees there, and I'm going to encourage everyone to buy more trees. Anyway, my financial disclosures are for Allergan, Novartis, and Shire. So I'm going to talk to you about dermal fillers. The American Society of Plastic Surgeons has a database, and in 2018, we had about 18 million total cosmetic procedures. And of those 18 million, 2 million were surgical. So it's interesting that there's such a great trend towards minimally invasive procedures. So 16 million minimally invasive procedures were performed in 2018. So when we compare that over the last few decades, we can see that there's a 24 times increase since 2000. So the key point is the cosmetic market is growing. We are in a great opportunity in our practices to tap into this, and we can add fillers to our practice if we are not already doing that. Even last year, there was a 2% increase. When we talk about fillers, we have to understand what is beauty. The ideals of beauty transcend all cultures, and there's quite a science to beauty. As you can see here in this New York Times magazine, we can see Madonna with her perfect heart-shaped face, and we can see that there's a focus on large eyes, high cheeks, and proportional noses, large smile. When we think about it, we can look at it mathematically and evaluate proportions. We have to highlight the shadows. And when we evaluate patients, we have to think about aging, because aging is characterized by descent, deflation, and demarcation. Specifically, in the soft tissue, we see loss of skin elasticity, we see evidence of muscle hyperactivity, we can see sagging, effects of gravity, and volume loss. And our perfect triangular face from youth is changing. So we see surface changes and subsurface changes. And in the subsurface, the fat, the muscle, and the bone are all affected. The causes of aging we know are intrinsic and extrinsic. Our carbon footprint doesn't help that. And we can see muscle atrophy and hyperactivity when we see this patient. You know, he comes in saying, "I'm tired. I look worn out." And you as the doctor, surgeon, can evaluate and say, look, we see the pigmentary changes, we see the loss of volume, we see the descent, and you can address that. Of course, there's a landmark study by PESA showing that there was fat loss in specific compartments. And as we get older, we lose bone. And it affects our mandible in the angle, and it affects the projection of our chin. We can see that there's a widening of the piriform aperture, our lips seem longer, we have a flatter brow, we lose our convexities, and there's rotation of the mandible. So as you assess patients, I think it's really important, especially in a cosmetic consult, to take the time to assess their goals and their expectations. What is beautiful for them based on their ethnicity? We should evaluate the whole face and see where is their descent of their malar tissue, where is their loss in their mid-face, and what are the contributors to the jowls. And if someone comes in and says, look, I really want my tear troughs done, we have to tell them specifically that they may not be the ideal candidate. They may need some surgery, they may need some lights and lasers, they may benefit from some fillers, some biostimulatory fillers, but they may need some other treatments as well. And it's important, you know, when we see patients, this is what he says. He says, I said to him, what is your expectations of surgery? He says, can you just make me look like my grandson? So, you know, we have to be practical, you know. I cannot make him look, I cannot make this Barbie look like this Barbie, right? We can't reverse completely the ages of time. So when patients have unrealistic expectations, we have to tell them, no, we can't do it. And this is actually a former beauty queen, and she came in and I just said, look, doing more surgery, doing more procedures is not going to help you. And her husband actually got up and shook my hand. So it's interesting because I think that we are in a position of authority that we can tell patients that we should not be doing it. So what makes Jennifer beautiful? She was considered one of the most beautiful women, according to People magazine, and we can see that it's balance and proportions. And so that's what I want you to remember. B is for beauty and balance. So it's an interesting study in vision research. They took a picture of a patient and they distorted the picture. And then they asked observers to grade which one was the most beautiful version of this lady. And we can see that the ones that were considered most beautiful were the ones that were most mathematically proportional. So A is for assessment, B is for balanced beauty, and C is customized. Choose the right filler. So there are a lot of fillers in the US market, and the ones in black are the US market fillers. We have a few more in Canada that are available. And these are the HA fillers, and the HA fillers have the greatest market of the fillers in the US. So Restylane, the family of Restylane products, Restylane Refine and Define, and I'm going to talk about them by brand name because it's very hard to talk about them with the generic names. Refine and Define differ by cross-linking, and L, Silk, and Lift have a 20 milligram per milliliter concentration. And I think it's important when you are starting off doing fillers that you think about the concentration, because the rheology are the properties of the product will help you understand where to put the filler, right? The thicker the filler may be better for projection of the chin or for the cheeks. The thinner the filler will be more malleable, may be better for the lips. And of course, the least hydrophilic filler will be better for the tear trough. So JUVEDERM Ultra, XC Ultra Plus, 24 milligrams per cc, 90% cross-linked and is characterized by hyalocrossing. And Volbella, Volure, Voluma, and Volite now in Canada, Volux in Canada, are all the Vicross family cross-linking method. Volbella is 15 milligrams per cc, 17.5 for Volure, and 20 milligrams per cc in Voluma. So as I said, the thicker the concentration, we may be able to put it in areas like Voluma is great for the cheek, and Volux now, actually, interestingly, which is 25 milligrams per cc, is great for the chin and for the jawline. That's the indication. It's a structural hyaluronic acid. And Volite is meant mostly for skin rejuvenation. Belotero in the US is 22.5. This is Belotero Balance. And in Canada, we actually have the whole family of the Belotero products. So we have the Belotero Balance, we have the Belotero Intense, and Volume. So we have similar, thicker products that can be used for cheek and nasolabial folds. And so the most important thing is, I think it's really important if you're going to start off doing fillers that you understand what you're doing, which type of product you're using, and just to be simple, the thicker the product, the more projection that you want to use a higher concentration or a higher G prime. So G prime, as you know or may know, is when it's a higher G prime, we are talking about a more stiff material, and it will potentially cause more lift. And there's lots of literature about G primes, and you can see that the higher the G prime are the products, these are the products that you're going to be using in the areas where you want to create more volume. So calcium hydroxyapatite, known as Radiesse, is one of the more biostimulatory fillers, and it's a calcium microsphere suspended in a water-based gel. It, of course, stimulates the body to produce more collagen, and it's quite biocompatible. It's also a really lovely filler and lasts longer in patients, and because you're stimulating the body to make collagen. This is an example of that patient we saw earlier, and when I was injecting his Radiesse, we can see in the way we're injecting it, I use a cannula for this, and we can use it structurally on the bone. Sculptra was initially approved for HIV facial lipoatrophy in around 2005. 2005, and then for cosmetic use in 2009, poly-L-lactic acid, and it's reconstituted with sterile water and lidocaine. So when a patient is coming in after your cosmetic consult, we've advised them, usually in our office, to stop any nutritional supplements if they're thinking about having their procedure that day. We try and give them arnica on the day of the procedure. They may start it before if they've done it before. Want you to always remember to take photos. Photos are very important in these procedures so that we can use photos to show the patient, to compare. And it's really useful. So I will actually take photos, and then I'll do pre-photos and then post-photos, post-injection photos, and then I show the patient in the room what the difference is. Informed consent, and in our consent, we specifically list all the complications that Rachna will talk about. And in terms of facial cleansing, there's a variety of cleanses and preps that are available. Stanhexidine is what we use in our practice, but 70% alcohol and hypochlorous acid has also been used. Anesthesia, typically I'm using a topical 30% lidocaine and a lipothiene base in my practice. I find that to be very comfortable for patients, and we all are evaluated on our comfort that we provide our patients. So we can inject either with a needle or a cannula. Some injectors prefer cannulas, but whatever you use, needle or cannula, nothing is 100% safe. There is always the risk of a complication. And of course, when we're injecting, we have to remember our anatomy, because the anatomy is critical. And we have to understand that, of course, there's going to be variations in the anatomy in our patients. So, for example, this patient came in, she was complaining of her lower eyelid bags, but I actually felt that she had quite a bit of cheek descent, so we're injecting hyaluronic acid in her cheeks. And this lady wanted to have her lips enhanced, and you can see that in our practice we will sometimes divide the vial that they have into smaller needles, because I find that it gives me more control using the BD syringe needle. This lady came in with tear troughs. In addition to addressing her tear trough using the cannula, we also used filler in her cheeks. And you can see that in the cannula video for her tear trough that I'm trying to go supraperiosteal. So I'm below the muscle, right onto the bone, trying to get that groove. And this is actually immediately post-op, so you can see exactly where I went in, right? But you can see that there's some improvement, and on the side profile, you can definitely see the improvement right away. And so this is a great tool. The photos are a great tool to also improve your practice and your skill set too, because you're evaluating your own results by studying your pictures. This is another example of tear trough with a hyaluronin. Pre and post tear trough. Of course, perioral lines are greatly improved by hyaluronic acid. And in my practice, we usually have complementary procedures. So there was a recent study by Shannon Humphreys that talked about multimodal therapy, and she talks about how doing more than one thing, or at least discussing it, whether you do it on the same day or not, discussing it and having a plan improves your retention of your patients. And of course, patients think that, of course, I'm getting the whole deal, right? So it's better for your practice to do that. So we complement our fillers with neuromodulators, we use the lights and lasers, and of course, surgery as indicated. Some examples of some oral commissures. And on, you know, without doing a filler, we always will talk about the complications. They're listed on our consent, and I think that it's important as ophthalmologists to be comfortable, to be able to address that. So I will never do a filler injection without hyaluronidase in my office. So the pearls for prevention are know the anatomy, inject slowly, use a small volume, use a low pressure, needle or cannula, you pick, and picking the right filler for the right place. I think that's the key. So remember your ABCs. A is for assessment, B is for beauty, balanced beauty, C, customize and choose the right filler, and C, be aware and be prepared of the complications. Thank you.
Thank you, Famita. Great talk.